Fracture-related infections post guidelines. Number one, surgery. This addressed surgical management fractures, and there should be a clear pathway for a leaky fracture with prompt consultant review. Number two, any patient who has signs of sepsis should have a consultant-led assessment immediately. Number three, diagnostic workup, blood cultures, plain radiography, photography of the wound should be available for comparison for subsequent imaging, subsequent views. Number four, IV antibiotic treatment should not be delayed in a septic patient. Number five, in a systemically one patient, the patient should be reviewed within 40 hours, and the antibiotics should not be commenced before the team review. If recurrent infection, discussed with MDT bone infection team. Number six, consider ultrasound guide aspiration on for cultures if surgery is delayed. Number six, at least 5 samples of culture should be taken. Number seven, empiric antibiotics should not be given without a diagnostic workup. Number eight, consider if metalwork can be removed in a fracture. Number nine, if empiric antibiotics are started, should be reviewed within 48 hours with culture results, and antimicrobial therapy should be narrowed to the culture specific as soon as possible. Number A9, at 24 hours antimicrobiology advice should be available.